All right. Um, Hello, my name is Jose Arias. I am a soon-to-be graduate in my bachelor's in kinesiology, as my internship units were the last that I needed in order to fully graduate. This year, I had the opportunity to intern at Miller Chiropractic and Wellness. Before getting into the rest of the presentation, I just wanted to talk about Dr. Miller for just a little bit. Dr. Miller is actually a Cal State East Bay alumni. He graduated some years back. He knew early on that the pathway he wanted to follow was in on the chiropractic side of kinesiology. After his undergrad, he enrolled in Life West, where he specialized in wrist, ankles, and the spine. Following his graduation from there, he decided to open up his own practice instead of working for someone else, which I will talk about later on. For this internship, I had various roles as I acted as the front desk, where I was just checking patients, answer the phone, schedule appointments, pretty much be that first person they see before taking them into a room to see Dr. Miller. When I wasn't at the front desk, I was actually able to shadow Dr. Miller as he treated patients. I got to see the various treatments that he would do and use to help ease patients whenever they were dealing with low back pain, tightness for their joints, shoulder stiffness, issues with their foot, ankle, pretty much any issue and pain that people had with their bodies. On occasion, and obviously with patient consent, I was able to get hands-on and being guided how assessing the tone of the body through palpations, which I'll kind of get more into later on, which is essentially just feeling the body for imbalances and knowing what to look for and going from there. Being that this is the Bay Area, there was a very diverse amount of patients that were coming in, patients that range from multiple cultural backgrounds with various bodily issues. So it was always an interesting day to be in the office. And then, as I mentioned earlier, like this is a small business. Instead of working for a bigger chiropractic office, he did decide to open up his own. So the connection to kinesiology courses, I would say the courses that were most relevant for this internship would obviously be anatomy, physiology, biomechanics, simply because in order to know what's going on, especially with treatment, uh, you I it was required to know the body well, being able to know the joint, the muscles, knowing the origins, the insertions, being able to pretty much assess the body and know where to go from there. So it was very important to know how the body works through like its actual movement and anatomical structure. Some of the other courses that I did mention that were relevant were exercise prescription. Dr. Miller wasn't just about cracking bags and doing all those videos that people see on social media where it's a huge crack of the back or the neck. Um, and he wasn't just about like, okay, we'll crack your back. I'll see you in a couple weeks. Dr. Miller was very passionate about educating his patients on how to help prevent or how to continue to improve to where at a certain point they wouldn't need to see him for months on end, which is something that I really did respect about Dr. Miller. Um, Critical issues of the body, I'll actually talk about that on a later slide on how that course was relevant to this internship. So skills in learning. I was able to gain a hands-on experience with palpation, as I mentioned earlier. Where pretty much Dr. Miller and the patient would allow me to feel certain joints for um, pretty much testing how mobile they are, feeling for tightness, puffiness, things of that sort, which essentially would raise red flags on like, oh, there's an issue here. which would then lead to some type of treatment that Dr. Miller would follow up with. I was able to go through patient interaction and communication, being that most days I was working front desk. So I would be the first person that patients would see. Um, my This wasn't too bad for me as I have had years of customer service. It was just a matter of applying that into a more clinical setting and learning the professionalisms of being in a healthcare setting. One of the things Dr. Miller really emphasized early on was about HIPAA, ensuring that um, pretty much patients' information does stay private. Um, Career impact. So after interning for Dr. Miller, um, it did help confirm that I am interested in rehab and training roles. I'm not too sure if chiropractic, the chiropractic side is for me specifically, but being able to see people leaving the office after getting adjusted, getting massage for their muscles to help ease any type of pain in their joints or muscles, they would leave in much better moods. And that is something that it was enjoyable to see. Um, so the multidisciplinary approach. Um, Earlier, I mentioned critical issues of the body being one of those courses that was related to this. And I mentioned that one specifically because one of the aspects I remember specifically about that class was the holistic approach versus a mechanical approach. Um, Early on in my undergrads, I remember in my introduction to kinesiology course, chiropractic practice was looked a little negatively. It was looked negatively upon by the professor teaching the course, simply because there are chiropractors out there that would simply just do an adjustment and then just wait for them to come back the next week or two, pretty much as a returning customer constantly, because they would fail to educate their patients on how to actually improve and better their condition. Um, so I would kind of say like they kind of had like a mechanical approach where they would just kind of treat the body and just let it be. Dr. Miller, however, had a very holistic approach towards his practice. He cared deeply about helping them out, not just in that acute sense, but to help bring longevity to them, teaching them how to exercises they should do, um, practices that they shouldn't follow, and always encouraging them to stay mobile, move. After every adjustment, he would always recommend patients take a short little walk, drink some water, kind of help reset the body so they can start building new habits that would actually make them have to go to the essentially make less appointments with him in the future. Which, as I said earlier, is something that I deeply respected about Dr. Miller, and his care for the actual patient. Um, Final thoughts. Not too sure if chiropractic is something that I would go into, but it was an experience I deeply appreciated as it got me exposed to something I never thought I would deeply look into. Um, yeah, I yeah, those are my final thoughts. Thank you.